So I would like to present to you Dr. Charles Ruefenacht. Did I pronounce it right?
Perfect.
Dr. Ruefenacht graduated from University of Utah with a bachelor's degree in pharmacological chemistry, followed by his dental degree from the UOP Dugoni School of Dentistry in 1983. He was CEREC user number 129. Frustrated with the counterintuitive results of bonding and cementing dicor restorations led him to find out how to glue teeth back together without mechanical retention. So in February 2006, that was the last time he cut full coverage crowns as a primary treatment. He is the founding secretary of the Academy of Biomimetic Dentistry and maintains a private practice based on purely adhesive retention. He is honorary fellow and founding member of the American Academy of Ozone Therapy. He's SMART certified and a naturopathic medical doctor graduate of IABDM. Please give a warm welcome to Dr. Charles Ruefenacht.
Thank you. Well, welcome to a very select group. You've actually managed to find the room. And who are already using a curing light, so you already know all there is to know about bonding. I hated dental materials in dental school. Learning about creep, flow, or is it my hearing aids?
No, it's just the weight on your name tag. Sorry.
Okay, I'll be nameless. So as I said, I was CEREC user 129, which means I just missed the free trip to Germany. And all the small little conservative preps I did with CEREC, the teeth cracked, and all the big blown out ones, they worked. And I couldn't figure out why. So I went on a dumpster dive to find people who knew dental materials about bonding. Okay, and so what I discovered was that bonding means you got to relearn everything you learned from dental school, because amalgam techniques and bonding techniques are 100% or 180 degrees opposite of each other. And let's see if I can push a button correctly. That was the wrong way. So now I need some help.
Do you know what that picture is? I'm curious.
No, it's not my picture. Let's see, so it's moving on the laptop, but it's not moving on the screen. Let me hit play. Okay, now we're rocking and rolling. So a little bit of history, because I believe in context. The guy on the right is Takao Fusuyama, who is dean of the Tokyo Medical Dental University in Tokyo. Their PhD program in dental materials has a minimum of 25 PhD students at any one time, all on dental materials. He invented total etch. Ray Bertolotti on the left is American dentist, got his PhD in ceramic engineering and then went to dental school. And then he went to Japan and learned total etch from Takao Fusuyama, brought it to the United States, and the ADA blackballed it for 10 years. So Ray's the father, he's the one who brought total etch to the US. He's still alive, still runs courses, go hear him. Okay, so here's the bonding conundrum. How do you attach a hydrophobic material to a hydrophilic material? Okay, in this case, zirconia to dentin and enamel. And yes, we can, and the great myth out there is that you can't bond to zirconia. That's false. You can bond to the zirconia well and predictably. Okay, so this is an example. This is 16 posterior units, essentially flat plane preps. Patient came, 2-hour airplane trip to see me, bonded it in a day, and I haven't seen him since. That's how much confidence I have in it. So since 2006, I've not been doing mechanical retention, just purely adhesive. It works, but you got to know something about dental materials You got to retrain your brain and start thinking about life as a bioengineer rather as a drill and fill, plug it dentist, which is what we learned in dental school. And don't feel guilty about it, because that's what we were taught to do. And the dental materials companies package adhesive materials and want you to use them as though they were amalgam. And you can't. They're completely different materials. You're just setting yourself up for failure. The unpublished insurance data shows that they expect class 2 composites to fail in 4.7 years. That's because we don't know how to use an adhesive material that shrinks. We're used to using a metallic material that expands. Okay, I got this case sitting up there at Phil Mollica's booth, the American Academy of Integrative Medicine and Dentistry, if you want to see it in 3D. This is what a typical substitute crown prep for me looks like. It's a onlay, okay? Let's see, I don't know if we got a red dot on this or not. I've got a peripheral rim of sound enamel, okay? No mechanical retention. I break contact just so the lab can give me a margin. Gary Enderbrink is an American dentist who was a research dentist for Verilink. He did an in-house study and showed that if you had properly bonded, well, let's see, you had more retentive strength in 1 square millimeter of properly bonded enamel than you did in a 3 millimeter high axial reduction crown using a conventional cement. 1 square millimeter of enamel. That's the retentive potential of proper bonding. Okay? That's a mind blower. 1 square millimeter. So this is a case of mine. Patient came in, he's a physician, really nervous guy. Was a failed endo case, extracted and grafted. So what are our treatment choices? Nothing, partial denture, implant. Timeline on an implant from extraction to final tooth placement is how long? 6, 9, 12 months. And then what do you got to manage? You got to manage the gingival aesthetics. Hope that doesn't die on you, yada, yada, yada. Alternative is a bonded zirconia bridge. Okay, and that's just bonded to the lingual of the cuspid, all right? Matthias Kern is the German dentist who's pioneered this. Before the days of zirconia, we used Rexillium metal alloys because Rexillium has nickel in it and other metal oxides, and you'll learn that they bond very well to tooth structure, but everyone's a little nervous about nickel these days, so we don't use Rexillium anymore. But it worked really well. And there's the lingual. This is Emax, it's Zirconia. Okay, so I had a really, really smart instructor in college teaching one of the calculus classes that I barely passed. And he had an analysis structure or analysis thought process that was brilliant, which is first define the question, what are you trying to solve? And that's hard to do sometimes. But if you can solve that question, what is it that I'm trying to accomplish? Then you can focus on how to solve it. And then you do that in step 2 by defining, what do I know about the problem? Okay? So in this particular case, what do I know about zirconia? What do I know about tooth structure? Okay, we're dentists, we went to dental school, but it didn't tell us a whole lot about the bioengineering of tooth structure, of dentin and enamel, and how it behaves under load and a bunch of other stuff, okay? And then the third step is, how do I apply what I know to solving this problem? And if I can't answer that question, then I need to spend a little more time on number 2, okay? So that was the formula that I followed when the supposed beautiful little CEREC Dicor restorations ended up breaking teeth, and the big wonky ones didn't, okay? And I just didn't know enough. So here's the money shot. You can leave after this one and you've learned it all. Okay. There are, let's see, last time I tried to count, there were over 100 different bonding systems out there, okay? They all behave a little bit differently. I have chosen a palette of materials that for me work all the time, and I have bastardized them a little bit to pick and choose components from each so that I'm using as few product as possible. When I first started doing purely adhesive ceramic restorations, I'd have one material that I'd use on the ceramic and one material on the tooth, and then the luting agent, and your mind wants to blow up by the end of the day. It's just too much. So what I've done is narrow that down to a few products that work. So the magic molecule that bonds to zirconia is this molecule called MDP. It's a 10-carbon chain molecule. It was invented by the Curari company, okay? They had a patent on it. The patent's worn off. So now other companies are making it, and it's their zirconia bonding agent. It's a very difficult molecule to make. It's difficult to make and keep pure. And so I pay a little more money and buy product from Curari because they invented it. They know how to make it. The parent company invented rayon. Rayon accounts for maybe 35% of the fiber that's made worldwide. This company knows polymer chemistry, okay? So, when you want to, the way you treat the zirconia is to air abrade it to clean it. You can use 27 micron aluminum oxide. Some of you are familiar with a lab study that was done where they sandblasted with it was a 100 micron particle at 150 psi, and then they had fractures in the ceramic. Well, none of us are using that kind of pressure and particle size clinically. If you're using 27 micron at 30 to 50 psi, you're cleaning and not microfracturing, so don't worry about it. The big bugaboo with zirconia is that you cannot clean it with phosphoric acid. That is the technique for a etchable ceramic. Zirconia is not etchable, okay? Zirconia has a phosphate binding site to it. When you wash it with phosphoric acid, you're now contaminating those phosphate binding sites with phosphoric acid. And then when you use anything else on it, nothing will stick. MDP, you'll see I've got a slide with the molecule. It has a phosphate group on it, and that's what attaches to the clean zirconia, okay? Never etch zirconia. If you goof up and do, sandblast it, okay? Okay, now on your tooth, because we want to keep things simple, we also want to use an MDB product, and that's Clearfill SE2, okay? So that is a self-etching bonding system. And what's nice about that is that your eluting agents is going to be Panavia F or Panavia F2.0, which is also an MDP monomer-based flowable composite. Okay, so you got the whole family, it's all MDP based. Does that make sense? Okay, Ward.
Does the S stand for fluoride?
I'm saying,
Does the F stand for fluoride?
no. I don't know what it stands for.
Some of them do. Some Canadians have fluoride.
Pardon?
Some Canadian does have fluoride.
Some,
And then, yeah.
well, let's see, SE Protect does, but SE2 does not. Okay. Now, to enhance bond strength, you can do selective etching on the enamel on your tooth with phosphoric acid. Rinse it off. Okay, so everyone understand the money shot? So the rest of the presentation is just talking a little more in depth about each of these topics, but I want you to understand the overview. Okay, we've all been given this big jigsaw puzzle box full of parts, bonding agents, and we don't know how to put the pieces together to get the picture we want. So I'm trying to give you a quick, easy way of understanding what's going on and how to make it simple. So Monday morning, you can do it and it works. So, rhetorical question. Is light curing bonding? Who's not using a light curing light? No one? Okay. When you turn that light on, what's it doing? Is it bonding? Is it causing bonding? Ward?
Polymerization,
Okay.
bonding, they're connecting up the links.
Okay. So Ward got it right. He gets, Janet, you got to give him the prize. All the light is doing is initiating polymerization of your light cured material. That's all it's doing. Okay? So let's see. Everyone stand up. Quickly, quickly. I ain't got a lot of time. Okay? Your monomers. You're each an MDP monomer. Okay? I turn the light on, and now you're going to hold hands with the person next to each other. Go, go. You got to move. Okay. Oh, we got a gap here. Great. Okay, now with one leg, you're going to stand on one leg and reach the person behind you or in front of you. That's cross-linking. Okay, sit down. Okay, so what happened volumetrically? When you started to polymerize, you started shrinking, right? Every time you turn a light on, that's what's happening. The monomers are aggregating into long-chain polymers, and then you're getting cross-branching, and you get shrinkage. Every single time. You can't cheat Mother Nature. Okay? So, is cementing bonding? No, cements are fillers. We all grew up with zinc phosphate. It just sets up hard as a rock so you don't have any space between your crown and your tooth, right? So light curing leads to bonding if you're not cheating Mother Nature. But just turning the light on doesn't mean you're bonding. It just means you're polymerizing. Okay, so I don't know if you can see this, but there's a composite that I was removing. I was doing it very slowly. Can you see the space there? Yes? No? Okay, that's because deep dentin bonds form more slowly. And when you use composite like amalgam, it's shrinking to itself. It's bonding to itself. So what's going to give first? The slowest bond to develop. And what's that bond? Deep dentin. Okay? So when you go back Monday morning and you're removing an old composite, do it slowly. See how many of these don't delaminate or haven't already delaminated. Sir?
So how critical is the curing electric?
Good question. So,
They have new laser curing.
right.
Very quick.
Can we save that for a little bit later? Because it's a really good question. I want to answer it, but it'll get answered. If not, throw something at me. Okay, so how's the bonding agent attaching to the tooth? So when we use the bonding, we think we're saying that it's somehow sticking to it, right? That's what we mean, or that's the imputed significance. I want you to think of bonding as the achievement of organic Velcro, okay? So we were taught mechanical retention, stovepipe hat dentistry, and if you were a kid during the 1800s in the wintertime, you made a snowball and tried to knock stovepipe hats off. Old men, because they couldn't chase you. And that's the crown technique. We want 3 millimeters of axial reduction so the dang thing doesn't rock. Okay, so our technique is benefiting what? What's dictating the treatment? The material is. Find one paper that proves that doing a full coverage crown has any benefit to the tooth. There are none. Okay, and you're all familiar with Velcro, hook and loop, okay? Which has more retention? The Velcro, right? Okay. So here's a photograph of dentin, a dentinal tubule. We have peritubular dentin, which is highly mineralized, and we have all these collagen fibers, okay? So when we're bonding, we're using an acidic medium to strip hydroxyapatite crystals off of each of these collagen fibers. So we're leaving little denuded fibers, kind of like spaghetti. And then when we put our bonding agent on, it gets in between and coats each of these little fibers. And then we turn the light on and it gets hard. Okay, that's the Velcro. And with self-etching systems, that's only 1 or 2 microns thick. And a micron is a thousandth of a millimeter. That's how retentive and powerful this system is compared to what we learned in dental school. Okay? So if you're doing your bonding properly, think of it as micromechanical Velcro. So, let's see. I already said all that. Now, the main retentive value when we're bonding is to all these fibers. It's not filling up that dentinal tubule. At the DEJ, that dentinal tubule is about 0.8 microns in diameter. The closer you get to the pulp, it gets bigger. So your bond strengths are going to be weaker more immediately just because you have less of this to bond to and more a big hole full of water. Okay, sidebar, and this gets almost to your question. How do you remove hydroxyapatite crystals? Well, you do it by applying an acidic solution. There are 3 ways of doing that. One's total etch with phosphoric acid. Second way is with self-etching systems. Bottle 1 is the acidic medium that is dissolving hydroxyapatite crystal, except we don't wash it off. And within that family of self-etching primers, you can have lightly acidic, medium acidic, and highly acidic monomers. And then the third way of dissolving the hydroxyapatite crystals is using the all-in-one bottle, where it has the acid and the bonding agent together. Okay. Clearfill SE2 is, by peer review research, the gold standard. So there are other good ones out there, but that's the gold standard just because so much research has been devoted to it. Total Etch Optibond FL. FL stands for filled, not fluoride. Okay, they're the gold standard total etch. Now, if you're doing total etch, you're getting 3 to 5 micron denuded collagen fiber instead of 1 to 2. And so in terms of bond strengths, total etch still is the gold standard, but you approximate the results with SE, and it's a little more idiot-proof for reasons we're not going to go into yet. Here's MDP. So we have a phosphate monomer, or moiety down here, and a vinyl moiety up here. So this is the hydrophobic or hydrophilic end that bonds to 2 structure, but it also bonds to zirconia. And then you have the hydrophobic end, and that's bonding to your composite. Okay. And this is a semi-hands-on course without the hands-on, so it's eyes-on. So here's SE2. The simple rule with almost all self-etching systems is the 20-second, 10-second rule. 20 seconds with the primer, 10 seconds with the bond, and light gear, okay? Now, just as a sidebar, when you're using your air to thin the primer, and this is a water-based primer, and your tooth is what kind of base? Is it acetone or alcohol? Well, it's water too, which is nice. So you are evaporating some of the solvent, and depending on which version of Shino you're using, I mean, you're the beta tester there, Shino 1, Shino 2, Shino 3, Shino 4, I don't know what kind of Shino they have now, but they went from alcohol to acetone to water, and I don't know what they're using. But anyway, what you're trying to do is thin that layer down as much as you can. That's why you're using your air on it. and then light cure it. Okay, so again, we're reviewing the money page. What do? We learn by repetition, I do anyway, so by default, you're gonna learn it too. Aerobrade your zirconia to clean it. Now, Matthias Kern has a nice little trick. He takes a magic marker. I kept referring to it as a felt pen, and my staff looked at me, what's a felt pen? Is it a magic marker? I go, what's a magic marker? So I said, Sharpie? Oh, Sharpie! Yes. So I have gray hair. So what he does is paint or wipe or color the bondable surface of the zirconia. Then he aerobrades that all off, and then he knows he's aerobrated everything. That's a cute little trick. Okay. Now the Danville micro etcher. I don't mean to embarrass anyone, but in Scouts when we're backpacking, instead of asking, is everyone ready, we ask, is anyone not ready? Okay. Anyone not using a micro etcher or sandblasting? You all are? Oh, cool. Okay, good. Another gold star, Janet. They all get one. Okay. And then never apply phosphoric acid. Yes, ma'am.
Excuse me, what about ibuprofen?
I'm sorry?
Ibuprofen, do you use ibuprofen?
That's a liquid, correct?
It's like purple.
Yeah. That's an MDP-based cleansing agent. Okay, that's fine.
But no need, if you sandblast, you don't need to use it?
No, you just go direct to the Panavia F2.0. Save a step. Okay, now Panavia F was only a chemical cure flowable composite. That's the first one that came out. Then they changed the chemistry and called it version 2.0 because now it's light cured. But it's also oxygen inhibited. So just a second. So all of these bondable materials will form an oxygen inhibited layer. But Panavia F2.0 won't cure at all if it's exposed to oxygen. So you can put a thin film on a paper pad and leave it overnight. It won't set as long as you're not exposed to light. Okay? So the way you activate it is to use a tube of glycerin, or they call it OxyGuard, squirt it on the margins, and that starts the polymerization. Okay? But all Panavia is a dual cure flowable composite. Okay, nothing more than that. That's what it is. We don't use it for buildups, solely for luting. Your question?
Does the Panavia act as a primer, or are you guys put a primer on the zirconia first, like Prime Plus, for example?
You don't need to. Panavia F2.0. Those 16 units that I had, flat preps, Panavia F2.0, nothing else. Okay, and then on your tooth, aerobrate it, clean all the schmutz off. SC2, mix up your Panavia, make your sandwich, squirt the OxyGuard on, you're good to go. Now, on the trade journals, how do they advertise cements and luting agents? They never talk about the physical properties of bond strength. What do they tell you? It's easy to clean up, right? Well, if it's easy to clean off the outside, is it sticking to the inside? There's no adhesive value to it, okay? So that's the fly in the ointment is you're gonna do a little work cleaning the extra Panavia off the outside because it's gonna stick. And a tip, I always use some Vaseline on the outside of the zirconia on the proximal contact areas to make it a little bit easier to clean up, okay? Okay, so I'm gonna repeat it again. MDP bonds to what? Class. It was a Sunday school. Give me a Hail Mary. Bonds to both. Okay. Just mix the Panavia up, put on your zirconia, it bonds. So what do we know about zirconia? It is not a metal. On the left we have zirconia metal. On the right is what we're using. It's a metal oxide. It's no longer a metal. Okay, and where does it come from? We'll pass over this. Heavy sand mining in Australia, South Africa. Number 4, it's always contaminated with hafnium, which is radioactive. So you want to ask your lab, how much do your pucks cost? And if they say 45 bucks, then you want to ask them, will you use the $120 pucks for me? Because it's being processed by somebody who's not doing a very good job, and the radiation's going to be higher than that $40 puck. Okay? Phosphoric acid contaminates it. Okay, that's repetition. What bonds to it? That's repetition. MDP. Okay? And MDP's been the backbone monomer for all of Carrari's products. So Photobond was their first, well, it wasn't their first, but it was their go-to total etch bonding system, which I still use. It's great on enamel, not so good on dentin. And then Panavia F2.0. So what else do we know about zirconia? If you dope it with enough yttrium, you can get cubic zirconia. But what's really interesting about zirconia, the Y3 zirconia, is that when a crack starts to grow in it, you get an increased concentration of force here, but that results in an expansion, about 3% of the zirconia. So that expansion changes the crystal structure of the zirconia and essentially pinches that crack shut. That's why zirconia is so crack resistant, fracture resistant. Okay? Yeah, and that's what sandblasted zirconia looks like. And review again, there's our monomer, our lovely monomer, no phosphoric acid. Here's the big bugaboo, phosphate group. Don't use it on zirconia. What are you not going to use on zirconia? Phosphoric acid. Very good. Simple, right? Okay, let's talk about Panavia. There's F2.0, the kit. Now in the kit, they have a dentin enamel bonding system. Don't get the kit. Just get the refills. Because SE2 or some other dentin enamel products work better. So you get tube A, tube B, and there's the OxyGuard on the end. Mix A plus B, spatulate it nice. Leave a nice thin film on your pad if you're not going to use it right away. Cover it with one of those black little light blockers. And then once you get it seated, and the nice thing about it being oxygen inhibited is that, especially if you're doing flat plane preps like me, orientation becomes a little bit of a bugaboo because you get the extra Panavia squirting out, and it's kind of hard to see your margins until you start wiping it off. So you can get everything oriented nicely and then squirt the OxyGuard on and start the initiation. Oh, okay. So something to just keep in the back of your mental suitcase. There's a weird surface effect with self-etching bonding systems. They inhibit the attachment through polymerization of dual cure buildup materials. Okay, let me say that again. When you're using a self-etching bonding system, you have a surface that's oxygen inhibited, non-polymerized. If you try and put a dual cure buildup material on top of that, it won't adhere due to some interface chemistry, unless you're buying a system from the manufacturer where they've already figured that out, or you're using a third bottle to your 2-bottle self-etching system that negates that surface effect. Does that make sense? Let me say that again, because it takes a while for new neuron pathways to generate. So you always have an oxygen-inhibited layer on any of these materials, right? So the oxygen-inhibited layer of self-etching systems inhibits the polymerization and attachment of a dual-cure material on top of it. Not a flowable composite, but a dual-cure material. Not paste composite, a dual-cure material, which is what build up. And then the exceptions are with Panavia and MDP and a product that Ray Bertolotti invented called Bulk EZ. That bonds to anything. So next year, the lecture's on Bulk EZ because it's the miracle flowable composite. Okay, so just be careful, okay? Doesn't apply to bonding to zirconia. That's just what I just got through explaining is just a sidebar, okay? Okay, so clinically, what do I do? So I've already done my try-in. Everything fits, right? So I air braid, and I've air braided the intaglio surface of the zirconia, right? So it's all nice and clean. I've got my pickup sticks, the wax stick, toothpick, got that stuck on. Everything's ready to go. Paint my Vaseline on the proximal sides, mix the Panavia up. My assistant's keeping the tooth dry and not watching me, and that's the hardest thing of the procedure because they always want to turn and watch me. And I'm telling them 27 times, don't watch me, keep that damn tooth dry, okay? So, that's an important thing. Now, since our bonding agents are hydrophilic, what happens if the tooth gets wet? Water is hydrophobic. Your bonded surface is the water's hydrophilic. I'm dyslexic. The bonded tooth surface is hydrophobic. Is the water going to stick to your bonded prep? No. So you can wash it off, wipe it off. If you want to be OCD like me, I wipe with some Bottle 2 SE or some unfilled resin just to make sure I got every molecule of water off. You're good to go. Don't worry about it. And one of the interesting things about the SE2, it has a mild astringent effect. So sometimes when you're cleaning things up, you get a little bleeder. That SE2 will stop it. And I don't know why. Oh.
Question. Do you apply the OxyGuard on top of the entire crown? Or just around the edges?
Just on the margins, just the margins. Seat the restoration, apply the OxyGuard, that starts the polymerization. Let it get going, feel with your Explorer to see when it starts to get semi-hard. Then run some floss through your contacts so you break up what are going to be large boulders that are a pain in the rear to get out. Okay, and then Ray Bertolotti likes the light cure in the margins. You get about a 10% reduction in bond strength by doing the light cure first, and he figures, what the heck? It's easier to clean up, but. Okay, review. What are we gonna do, the zirconia? Class? No phosphoric acid? How are you gonna clean it? Air braid. Okay. What are you gonna do to the tooth? Air braid. Then what's your bonding agent, at least for me if you're in my office? SE2, light cure, mix up your Panavia. Why does that work? Why does MDP stick to zirconia? Phosphate bonding groups.
So you were saying when you put it on, put the OxyGuard on, you don't think you should go and light cure it all, like tap light cure it, or you?
It's up to you. 6 of one, half dozen of the other. Okay. So what are the advantages? You got a hermetic seal, preventing bacterial tubular ingression. When you're doing flat plane preps, you're staying well away from the pulp. By the time traditional dentistry says you need a crown, is there any occlusal surface left? Except for maybe a rim of enamel? No, not much left. So all you're doing is removing some enamel, and that's not affecting the pulp. What kills the nerve is doing the axial reduction. Because at the gingiva, the wall, or the tooth wall thickness is only 2 or 3 millimeters thick. And you're taking 1.5 millimeters off. And then you wonder why the tooth abscesses. You do a full coverage crown, you got a 3% risk per year, the nerve's gonna die, and that's additive per year. So who are we benefiting? We got a good lab, or a research paper from '84 where they took extracted bicuspids, rebuilt them with composite, put them under load. With the materials then, if they used the material right, the tooth broke before the restorative did. That's with materials 40 years old. Bonding's not the problem, it's our brains. And it takes us dentists, a couple of years, once you hear the voodoo like this, to kind of wrap your brain around it and decide, yeah, maybe I want to try it. It takes your patients about 7 seconds. Your patients are happier, and from an engineering perspective, which is what we should be thinking of ourselves as biological engineers, we're putting that tooth back into strain harmony. This tooth is an English wooden barn. It's got a hard shell of enamel that's crystalline and brittle. It's got an inner core that's 25 to 50% hydroxyapatite. And then you have an interface level that's very mushy, which is the DEJ. And it's about 200 microns thick. It's the shock absorber mechanism of the tooth. So that when you bite on that virgin tooth, there's flexure. Okay? You cut a square hole in that tooth and fill it full of amalgam. Tooth can't flex. Where does stress concentrate at? Right angles. And why were we taught to do that? So we could pass the boards and prove that we were a good freehand milling machine operator. It had nothing to do with the health of the tooth. So now the shock absorber mechanism is crack propagation. So when you learn to use adhesive materials to their full advantage, you can put the flexure back into the tooth and minimize the amount of healthy tooth amputation and keep the pulp alive, which should be our goal. So it's one thing to get all the mercury out safely, but what do you do then? You're gonna kill the nerve by doing a crown? No. Glue it back together. Air abrasion, once you get into it, get the one on the right. I couldn't practice dentistry without air abrasion. I mean, you can treat kids without anesthesia, using air abrasion, remove the decay, whole host of things. Okay, so what our bucket full of bonding materials give us is, to the artist, a palette of different colors. We got SE2, we got Photobond, which we didn't talk about, Prelude, which is Ray Bertolotti's upgraded version of Optibond FL, which we didn't talk about. That's a porcelain activator, or a silane, okay? So when you use etchable ceramics, you have to have something that will attach to the etched ceramic, right? And that class of molecules are called silanes. And then your bondable agent will attach to the silane. Well, people who are making silane starts to decompose the day they put it in the bottle. Carrara's figured out a way to give you stable silane. He mix it with an acidic solution to activate it. That's why that's up there. Bulky Z, which is the wonder material. I use that for most of my luting of etched dilithium silicate Emax. And your favorite composite to use in Panavia. And there's a friend of mine's palette. He's a pretty famous artist. So with bonding, if you know how to bond properly to enamel and dentin, you can do shallow class 1s without postoperative sensitivity, because now you've controlled polymerization shrinkage. You can do deep box restorations, and they last for years, because you can know how to control your polymerization shrinkage. You can add contacts to etched ceramics. Get it back from the lab, you got a space, what's your choice? Send it back, or, well, bond some composite to the contact, it's durable. You can do porcelain repair. Patient breaks their porcelain on the bridge. Is it $5 for a new bridge, or are you going to fix it for them? Well, understanding the dental materials of adhesive materials, you can fix it. Buy them some time. You can do cantilever bridges instead of implants. You get to figure out, or you can reestablish the shock absorber zone in the tooth using Kevlar mesh, polyethylene mesh, Rib-On. You know the difference between luting or bonding a restoration on as opposed to just cementing. You'll fall in love with Emax because it's a beautiful material, and when you use bulk EZ as the luting agent, the margins just disappear. Looks like enamel. You know how to bond zirconia, make it work for you. Take the mystery out. Bite the bullet, drink the Kool-Aid, flat plane preps. You won't sleep at night, but they work. You'll lose a few pounds sweating, but they work. And your patients love it because inherently they know crown's not a good idea. No one breaks into a big smile when you tell them, you need a crown. They go, oh, do I need a root canal too? Let me see, have I paid for my boat yet? Okay, you'll understand how to, or why etching works, and make it work for you so you don't end up with postoperative sensitivity. Instead of dumpster diving with crown lengthening, you can grow the tooth out of the gingival tissue, call it raising the box. Now your margin is in composite. That's easy to take an impression of. And in the end, you become an artist, and you produce beauty. And now you're the master of your ship, okay? And people come to you because you do things a little bit differently. So, supplies, learned more. Matthias Kern has a book out from one of the major, I can't remember their name, and the title is Resin Bonded Fixed Dental Prosthesis, but he explains how to do the Zirconia cantilever bridges. Shasta Dental Supply is run by Ray Bertolotti's nephew, Ryan. He knows more about bonding than most dentists do, so I like to get my product from him, but especially if you're in your extended learning phase, he answers questions. Ray Bertolotti still does some courses. Carrari America has got a great website and cookbook PDFs on how to use their product. I have tried to limit the number of products I have to use to make it simple and fast. So the dental materials company are not expecting us to be exceptionally familiar with chemistry of adhesion. And so they make systems. And they work. But they're directed to a certain application, and then you have to have a different set of products to make each application work. That's how I started out, but it just became too confusing for my brain. So I figured out, here's a couple of products that I can mix and match, given the situation, to get me to my end result. And then we'll be doing some courses this year. So the end, hopefully the beginning. Remember, it's all about the Velcro, it's all about the bond, and you had a question I didn't answer.
Well, you didn't discuss the
Curing light, okay.
I had another question.
Okay, so curing. So in light cured materials, there is a molecule called a camphophonone, and it converts light energy to chemical energy, okay? Given the number of camphoquinones, they only work so fast. Doesn't matter how much more light you give them, there is a maximum rate of polymerization, right? Okay, so that's point number one. Number two, all these adhesive materials are fluid, correct? They're either pastes or flowables or liquids, right? Okay, the point at which they become hard is called the gel point. Now, once polymerization, remember you all stood up and you were shuffling back and forth? You were polymerizing. At some point, you stop moving. That's the gel point. Now, with adhesives, there's still contracture. Okay? So you want as much shrinkage going on before the gel point is reached. So that's why bulky Z is so nice, because it's a 90-second point to gel point. All the polymerization occurs before it sets. Now, if you got the space-age Darth Vader light that cures in a nanosecond, you've reached the gel point in a nanosecond, but the polymerization shrinkage hasn't occurred yet. It's still going on. So now you have a material that's under stress. It's trying to shrink, and you want it connected to the tooth. And now someone's going to start chewing on it and flexing the tooth. So your strong bonds, which are the material to itself and to enamel, will remain. Deep dentin bonds will fail. So the daddy answer to your question is you want low light energy and slow. But that's not the advertising. The advertising is you got a 2,000 watt LED and it's going to fry it in a nanosecond. Well, it does, but it's not really what you want. Yes?
I have a question. Zirconia to zirconia.
Not a problem. Panavia, MDP. So that's a good question. I had a patient yesterday. She came in, I had a 3/4 crown, restoration, not a crown, Emax, and she broke off the part of the palatal cusp, number 2. So, and there wasn't a whole lot of tooth structure there to begin with, but there was my restoration originally. So I just used that as the buildup. Now, if I have to cut old Emax off that I properly bonded, it's a pain in the gluteal muscles. You're grinding every molecule off. It's just part of the buildup.
Sure.
But it should apply to zirconia as well.
Classics, talking about a zirconia crown and a zirconia.
Yeah, I would do it.
Is your
Any special?
Go.
There you go.
As your rule of thumb, like on, let's say, second molars, if you're doing any occlusive restorative, like, would you do a flat plane with zirconia versus,
Yeah.
where would you only use your Emax, just out of curiosity?
Well, Emax is great as long as you got a couple, 2 millimeters. So if I'm on the thin side, I'd go with the zirconia, and on the second molar, no one's going to see it anyway.
Thank you.
Sir?
What do you mean by flat plane? I missed that part.
Flat. Okay, so think of it this way.
Not doing axial reduction at all.
No axial reduction. Flat.
So you're only doing the top half of the tooth then?
Okay, so think of it this way. Who remembers retreading tires? I know Ward does. Okay, that's what I tell a patient. I'm retreading the occlusal of your tooth. I've got a slide up here I can show you. Or you come to the booth and you can see the model. But it's essentially just flat. I do give a little bit of shape just for orientation, but flat.
You break the contact?
Yes, because it makes, yeah. There, let's see. I'm afraid I'm going to do it this way. No. There. Okay. Flat. I do have a bevel. I do bevel on the enamel because you want the ends of enamel rods. You don't want to bond to the side of the enamel rod. Okay. But that's not a mechanically retentive prep. It will orient, but there's no mechanical retention. Okay, I'm done.
You'll be at the speakers forum, right?
Yeah.
If you have more questions, you can bring them to the
Thank you.
speakers forum if I- Can I borrow yours? Thanks, Dr. Ruefenacht.
Hey, thanks for coming. Yeah, this is Geekville stuff, but thanks for coming.
Okay, I have the AGD completion code. I'll repeat it 3 times. BZ as in bonding zirconia, 32224, CR for Charles Ruefenacht. BZ 32224, CR. and